Namaste, this is Dr. Ravikiran Barigala. I'm an infectious disease physician at Apollo Hospital, Hyderabad. Today we will be talking about measles and how it affects different age groups, starting from a child to an adult to an older adult and other age groups also. Thank you.
Namaste, my name is Bhuvan. What is measles? How do we get it?
So Bhuvan, measles is an infection. You get it through somebody else. Like one person might have it and they might have some fever or cough, but mainly it is through droplets or some respiratory particles. Like when we cough, there are some small sputum, particles that will come and it will go everywhere. If you're very close to somebody who has measles, or if you touch the surroundings where the measles person is, through your hands, you touch your face, your mouth, your eyes, then you can get measles.
What are the chances of me or other children getting affected by it?
Most children who get measles will have a very minor fever, rash, body pains, vomiting, but mild infections. And actually most people won't even get it as a child because they got a vaccine when they were small babies. Before 1 year of age or so, they might get vaccines. With that, you can prevent measles. Some people might still get it, but that's very rare. Even if you do get it afterwards, the infection is very minor. It won't cause too many problems. If we do get it, then we should try to be safe so that we will not give the infection to other friends, like your school friends, some other friends that you play in your neighborhood. So they should not be getting it. So you should be in the house inside one room so others will not be able to get it.
Namaste and hello doctor. I am Jasmine and I am having few questions on measles. So my first question is, who is at risk for measles?
Hello Jasmine, that's a good question about measles, who can get it. So anybody can get it. The highest risk is the younger children who have especially never been vaccinated. People who are vaccinated will rarely ever get it. Even if they get it, the illness is very, very mild. The other age group would be maybe elderly who had a vaccine as a child. But as I've mentioned, the vaccine immunity goes down as we get older. And after 30, 40, 50, 60 years of age, the immunity is hardly there. So those people, if they're in contact with somebody with measles, they may be more at risk. Other people like HIV or transplants or people who are low immunity for any reason, they may also be at higher risk.
So doctor, are those rashes which you were talking about, are they permanent or they are disfigurement?
So Jasmine, that's a good question, especially for teenagers. That's a big concern, whether it's going to cause a permanent damage to their skin. But fortunately, we don't have anything that is permanent or it will cause any disfigurement. These are just minor rashes, last for just a few days, and it will be gone after a few days. You will not have this black or any marks on your face or on your body for a long term. It will just be a short term.
So doctor, what are the risk factors if measles are untreated?
Most of the time, measles is self-limited and it goes away by itself. Just medications for fever or rashes, itching is sufficient. But rarely, if we don't do anything or because of your immunity being low, it might start affecting your organs like your lungs, your brain or some other organs. At that time, we need to give those treatments specifically. And if adequate treatment at the right time is not given, they develop into complications, secondary infections, brain problems, and even permanent damage, which can affect your breathing, it can affect your mind, and even it can cause death. So we do have to be careful with measles.
Hi doctor, I'm Shanti. So doctor, I wanted to know, what should a mother take precautions when their children are affected with measles?
So once a child gets measles, they may start developing a few symptoms. Some of the common symptoms are fevers, rash, maybe sometimes cold, vomiting and diarrhea. So as a mother, you have to make sure that they are doing well in all of those things. Most of the times we really do not need an admission, but just symptomatic management at home. So make sure that their fever is down, make sure that they're eating well, make sure that they're not throwing up, or if they're having diarrhea, maybe support them going to the bathrooms, encouraging them to eat some things, and just even boosting them. But at the same time, as much as you're taking care of them, you have to make sure that you do not get infected yourself. So because it's an infectious virus, just like COVID, we have to protect ourselves. So way to protect ourselves is to wear a mask, a good mask, if possible a 95 mask, and also having a face shield and using some gloves. Whatever we touch, that might get infected. So we have to make sure that all of those surfaces are clean, and the gloves that you wear after you touch at least any of those surroundings, you take that out and dump it away. So don't reuse the same gloves, and use your hand sanitizer to clean your hands, wash your face or everything so that nothing will be infected to you. And if the child is having any vomiting or motions and you're cleaning that, make sure that that part is also not contaminating anything else. Make sure that you wash your hands when you're handling any of those secretions, and when you're taking care of any oral secretions, also clean your hands well, and make sure that they take the medicines on time, and make sure they also eat and drink good amount of food and water.
Doctor, how can I tell the difference between measles and any other rash?
So measles rash is very typical rash, which is very different from many other rashes, but sometimes it can be hard to tell the difference. First, you might see spots inside your mouth before you even see anywhere else on the body. So afterwards, you start having some spots. It's more like a rash, maybe a raised bumps, or just a red color rash all over your body, which are more like spottish. It's not like a completely red rash, but just spots all over the body, and those spots keep spreading. They may or may not itch, and it starts from the chest, abdomen, and it goes everywhere in your body, in your arms, legs, face, everywhere it can go. And it is not very painful, and slowly resolve after a few days.
So, doctor, who needs these booster doses of vaccination for measles?
That's a good question. So most national programs have a vaccine in part of their national immunization program, and they're given as a child, usually around 9 months or 1 year, something like that. They will give it 2 doses of the vaccine, a month apart. And afterwards, most people do very well. They don't need any booster dosages after that. We do recommend it for older adults if their immunity is low. Let's say cancer patients are there or HIV patients are there. For them, their immunity may be lower, they may be more likely to get it, or if they get it, they may have a more severe illness. So for them, we do recommend maybe after the age of 18 or 20, they might need a booster dose of the vaccine.
Namaste, I am Sanjay. Are adults at risk of getting affected with measles? And if so, do they have to immunize themselves? What will be the right age for them to get vaccinated against measles?
That's a good question, sir. Actually, in many places, especially even in Western countries, once you're starting college, that's like 18 years or so, for many colleges, they actually require that you do a test to make sure that you have enough immunity against measles and other infections. And if you do not have adequate immunity, then you get a booster shot. In India, we don't do that commonly, but there are a few groups that we do recommend it, which are like healthcare professionals. So for people like me, before I joined the hospital or medical line of work, I was tested, and if my levels were low, I'm asked to take a vaccine again. And typically we give 1 or 2 dosages as boosters. Many times 1 may be enough if you had a vaccine as a child, but sometimes you don't even know, you don't remember if you've had 1 or 2. So if the levels of the vaccine immunity is too low, we'll just recommend that you take 2 vaccines by itself. Taking a vaccines even without checking the antibody levels may also be fine, because it's a very safe vaccine. We give 2 doses 28 days apart, so about a month apart, 2 dosages. And for other age groups like people who have HIV, cancers, other immunosuppressions, for them also we recommend MMR vaccines.
Do the vaccine against measles have any side effect? And also I would like to know if people with diabetes or high blood pressure, get any side effects due to this vaccination?
Okay, so that's a good question that you asked about the effectiveness of the vaccine and if people with diabetes and hypertension can take it. Absolutely, the vaccines are very safe. The only side effects you can have really is the pain that you might get. All vaccines, it's an injection, so you will have some pain wherever you take it, your arm, your buttocks, and you may be local pain. Some people may have some fever, some people might feel soreness or headaches. We do recommend that people who have a very low immunity in certain conditions, they actually should not take the vaccine. Like people who are transplant patients right after the transplant, or if an HIV patient is there and immunity is very, very low, because that can trigger a different reaction for them, but not for diabetes and hypertension patients. They're very safe, and no matter what medicines you're taking, even insulin if you're taking for diabetes, it is still safe and no problems with it. Thank you everybody for watching this program today, and we talked today about measles and how it can affect different age groups, right from teenagers to all the way to the elderly, even children and adults and other people, and how each person reacts differently. What are some of the tests? What are some of the treatments? How can we even prevent it? We learned many things today. So stay informed, stay safe, and do not take any treatments without talking to your doctor and getting accurate medical advice. Thank you. Namaste.